Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. We are discussing mommy makeovers, which is a name for a combination of procedures that focus on addressing those areas affected by childbirth and may include a breast lift, breast augmentation, or tummy tuck, depending on the needs of the patient. Joining us is board-certified plastic surgeon Dr. Barrett, who has a private practice in Beverly Hills, California. Dr. Barrett is an active member of both the American Society of Plastic Surgery and the American Society of Aesthetic Plastic Surgery. Utilizing a holistic approach that provides natural-looking results with minimal scarring and downtime, he specializes in aesthetic and reconstructive surgery of the face, nose, and body. In this episode, let's listen as Dr. Barrett talks candidly about mommy makeovers and shares what you need to know to decide if this type of surgery is right for you. Hi, I'm Amy, and we are joining you live from the studio today with Dr. Barrett, who is going to give us some insight into mommy makeovers. How are you today?
I'm wonderful. Amy, how are you doing?
You know, I'm great. We're excited to have you here.
Me too.
We've got a lot of questions to ask you, but first we want to get to know you a little better.
Okay.
So, if you couldn't be a plastic surgeon, what would you be?
You know, I love helping people, so I'd probably be a philanthropist of some sort.
Okay.
Yeah, just figuring out ways to solve problems on a bigger scale.
Wonderful.
Yeah.
What about the best piece of advice you've ever received?
Work smarter, not harder.
I love that.
Yeah, it's a good one.
It is a good one. Tried and true.
Yep.
What about your favorite food?
Man, so I grew up in Virginia. There's a bay called the Chesapeake Bay in Virginia, and they have these little crabs called blue crabs, Chesapeake Bay blue crabs. And if you douse them with enough Old Bay, or whether you're not to do that or not, they're just amazing. So Chesapeake Bay blue crabs is my favorite food.
Okay,
Yeah.
good to know.
But
that sounds delicious. I don't know if you have to get them there, right?
You have to get them there. You can try to get them elsewhere, but they're never as good as if you get them fresh from there. And if you're from the Bay Area, you know what I'm talking about.
What's your favorite thing to do on your day off?
My favorite thing to do on my day off is to go outside. We're here in beautiful Southern California. I love to go outside. I love to go hiking. Just getting up in the mountains, doing either a bike ride or a hike with my daughter is just a great way to get some fresh air, get some sunshine. It just totally resets my batteries.
What is one thing you absolutely could not live without?
One thing that I could absolutely not live without, I'd have to say my Theragun. It's a little vibrating thing that kind of massages your muscles, and I do it every day. And it's just like if you have sore muscles or if you have a bad or long day in the operating room, it's great to do on your back. It just kind of loosens you up. Yeah, that's my latest gadget, and I don't think I can live without it.
All right, good to know. How about anything you've binged watched lately?
The Mandalorian. So I kind of grew up as a Star Wars fan.
Okay.
It just came out of Disney Plus, and I could not wait till the next episode came out. So Mandalorian, that followed by Stranger Things, and of course Game of Thrones. Can't beat that.
Can't beat it.
Yeah.
Tell us a little bit about your journey to plastic surgery.
So my journey to plastic surgery, I guess it started when I was in high school, and I was interested in science and helping people. And fortunately, my dad had lung cancer because he smoked his whole life, and I got exposed to healthcare and a lot of doctors helping my family, and that kind of exposed me to healthcare. None of my family had any healthcare providers, so it was a completely new field for me. And I decided to become a doctor. And when I got into medical school, I exposed myself to various fields. Went into oncology thinking that that's kind of what I wanted to do, but turns out it was just too emotional for me. I also realized at the time that I had much more of a surgeon capability in terms of working with my hands. I do give my dad credit for that because we used to always work on cars together when I was younger.
Aw.
And I used to just figure out ways to kind of take out little parts of the car that he couldn't like believe that I was able to do. So, which I think has benefited me my whole life. But so I knew I wanted to be a surgeon. I love plastic surgery because it's just a great way to improve someone's life, and there's an artistic edge to that makes a big difference. I'm OCD in a lot of ways with the way things look. I walk into a room, I see a picture frame slightly off, I have to fix it. And I think that translates well to a plastic surgeon in terms of attention to detail. I think is super important.
Absolutely. Can you tell us a little bit about your credentials?
Absolutely. So I went to medical school at the Medical College of Virginia. I have an MD there. I also got a master's in health administration at the same time, so it's a 5-year program.
Wow.
Also have a master's in science in addition to that. So I have 2 master's degrees and an MD. Got accepted into plastic surgery integrated residency at University of Southern California right here in SoCal for a 6-year integrated program. And I've been in private practice in Beverly Hills for the past 5 years.
Wow. Okay, well, we want to learn a little bit about mommy makeovers from you.
Sure.
So first and foremost, what is a mommy makeover?
So your mom, and you have 2, 3, 4, 5, 6, 7 children, all of which some of my patients have had. It's a beautiful thing, but it takes a toll on your body, and it's a sacrifice. So a mommy makeover is typically a combination procedure that is designed to help correct and rejuvenate the body for moms.
Okay.
Main one, tummy tuck, right? We get the loose skin from having pregnancy, stretch marks, rectus diastasis, which is actually widening of your pectoralis muscles. So that procedure is combining the plication of the muscles back together, repair that, taking care of the extra skin. Now, traditionally, it's been some kind of breast surgery with that, like a breast lift, breast augmentation. Now, we have what's called a Grand Slam mommy makeover, which is tummy tuck, breast lift or breast augmentation, and then fat transferred buttocks. So we'll do the lipo with the tummy tuck. We'll take that fat and we'll transfer the buttocks at the same time. So we get kind of overall a better hourglass figure that I think, I call it the Grand Slam. For,
I never heard that before.
yeah,
That's your term.
It's my term. I call it the Grand Slam mommy makeover because it just goes after 3 main areas. Because after you're done breastfeeding and you lose all the weight from pregnancy, your butt can kind of drop, your breasts drop, your tummy drop, everything drops. So it's just a more comprehensive way to kind of lift all that. Now you don't need all of them. You can just do the tummy tuck, you can just do the breast or whatever. But collectively we call it a mommy makeover if you're a mom and you're really trying to rejuvenate these main targeted areas.
So other than being a mom, what else makes someone a good candidate for this surgery?
Somebody who has laxity, so they've had weight gain, and you know, they say you're not supposed to gain more than 30 pounds during pregnancy. That's easier said than done. Okay, so when my wife was pregnant, I gained weight. Okay, so it's just like it's just something happens that you just kind of, you know, you just get comfortable and you're eating for 2 and whatever it is, or you're not working out as much because of the baby. It's totally fine. But if you do get that weight gain and then the weight loss, that can stretch out the skin, and skin doesn't always go back. It goes back about 30%, and so that you see that in the breasts, you see that in the tummy, and sometimes you see it in the buttocks. And so anybody that's had weight gain, weight loss is actually a good candidate. You don't necessarily need to be a mom, but those are things that are typically coinciding with these type of procedures.
Okay. Typically, how much does a mommy makeover cost? I know it probably varies depending on Grand Slam or not.
Yeah. So our basic our basic mommy makeover would be like a tummy tuck and a breast augmentation. That costs anywhere from $10,000 to $20,000, depending on what exactly you need. If you have to have a breast lift at the same time, it's all dependent, at least in my office, about how much time it's going to take.
Gotcha.
So if you've never had previous surgery, if you don't have a hernia, you know, a lot of people get umbilical hernias. If you don't have any or C-section scars that we have to spend time to kind of lift up, you know, a tummy tuck can be as low as like $7,000 or $8,000. But if there's more time involved, major scarring or previous surgery, that all adds time and adds to the cost. So that's where you can get, you know, if someone's doing tummy, breasts, buttocks, you can get over $20,000 for something like that.
Okay. Are there payment options available for somebody who wants to undergo these procedures?
Absolutely. Not everybody has $20,000 sitting around on their I guess the fire, yeah, the nightstand. I hope not. Put it in a money market or something. But yeah, so we have financing options. Our favorite go-to is CareCredit because it's so easy. It's easy for our patients. It's easy for our office. Yeah.
So someone who has decided they want to have a mommy makeover, but they're figuring out all the logistics, what should they look for in a plastic surgeon?
So that's a great question. A mommy makeover is a big procedure, and there can be high complications for plastic surgeons or for surgeons that are not really qualified. So the very first thing, I do kind of call it the pyramid of what to look for. The very bottom of that needs to be board certification. You don't want a dermatologist doing this procedure on you, right? So they're great at skin, but they're not good at doing surgery, okay? So the bottom of the pyramid, board certified by the American Board of Plastic Surgery. There's a lot of doctors that say, oh, I'm board certified. What are you board certified in? Is it board certified in general surgery? Is it board certification in family practice? You got to pay attention to that because a lot of people will say, board certified, okay, what does that really mean? It needs to be the American Board of Plastic Surgery. Results. Do you like the results you see? Is the belly button look like a tiny little coin slot at a Vegas, what are those slot machines? Yeah. Is that what it looks like? Or does it actually look like a natural belly button? Look at the finer details. How bad is the scar? Are they showing the scar, right? Next one up the line is, do they have good reviews? Okay, are people having good experiences, or is it turn and burn? They go there, they take their money, they do a surgery, and then boom, they're gone, right? So check the reviews. And then lastly, the top of the pyramid, the icing on the cake is, do you mesh well with that surgeon? Do you feel like they're going to be there if you have a complication? Do they give out their phone number to you in case you're having major problems? Or is there a way to get a hold of them? That's really important because these are major operations, and people can die. Very, very rarely. I've never had anybody die, but like if you don't take this very seriously, this is someone's life in your hands, So you want a doctor that takes that very seriously, and you want to make sure that they're on the same page in terms of what your results or what your expectations are.
Absolutely.
Yeah.
So you've kind of touched on this as well, but what specific questions should the patient ask during the consultation? Obviously, number one is, are you a board-certified plastic surgeon?
Absolutely. Are you board-certified? How many of these do you do a month? So you want at least, I would say for tummy tucks, for mommy makeovers, you want at least, anywhere from 2 to 20. Right? You don't want much more than 20 because then you're going to start thinking that this place is a factory. Yeah, so my operations, I'm very good at mommy makeovers. I do a lot of them. A lot of them are combined with some of my breast procedures. I would say I probably do about 2 to 3 a week. And it's not the quantity that matters so much as the quality. So I could do more in a day if I wanted to, but I don't like to cut corners. And there's little details that I work on, like the plication that we do to bring the muscles together in the middle. I do a double layer of that, right? Most surgeons, they only do a single layer. Will you know if I do a double layer or not? Nope, you'll never know that. But these are the little details that I do because when I go home at the end of the day, I want to make sure, in my mind, that 10 years from now that your plication holds up and that you're not going to have problems down the line because otherwise I don't feel good about that. Those are some little details that you can ask, but mainly you can tell a lot of that stuff with the results. But when you're asking, ask these questions during the consultation to get a better sense.
Okay. What risks and complications are associated with a mommy makeover?
Yes. So mommy makeover, there could be some risk. And the main portion of that is from the tummy tuck procedure. Okay. So typically patients are a little bit older. The main risk that we worry about for a tummy tuck procedure is a blood clot or DVT. And that happens because when we tighten the tummy muscles, we're decreasing the venous return. So the blood goes to your legs and then it comes back up. And if you cut off that blood supply just a little bit, you can get a blood clot in your leg that can later travel to your lungs. So the major thing that we worry about is blood clots. And that's why we do little leg squeezers, we do compression stockings, we make sure that if you have any risk factors for blood clots that we give you anticoagulation therapy. That is probably not the most common thing that happens, though. That's the most devastating thing that can happen, and I don't want to scare people away because we've never had one. We do lots, but we do take a lot of the prophylactic measures. The most common thing to happen is infection. Imagine you having a big incision right here. There's a lot of skin. There's a lot of little places for bacteria to kind of sneak in, and so infection is the most common thing. I do prescribe antibiotics. I have had abscesses. We always deal with it in the office. Typically, patients have a BMI over 25 when they're getting this higher risk things happening. So we try to risk stratify our patients prior. We don't say no to people with a BMI over 25 or 30 or whatever, but we just want to be very careful that patients understand the risk profile going into the surgery.
Okay.
Yeah.
Can you provide kind of an overview of the various procedures that are available for Mommy Makeover?
Yeah, so the overview is number one is the tummy tuck. All right, so that's probably what everybody really wants, and that gets rid of the skin, gets rid of the stretch marks. You know, how do you know if you need a tummy tuck though? A lot of people ask, "Oh, I just need lipo." Right? Lipo is like it just takes the fat out.
Right.
But if you look in the mirror and you look at your belly button and you don't see a circle anymore, you see just an upside down sad face. You need a tummy tuck, okay? If you have the little sad face in the mirror.
I'm not trying to laugh. I'm sorry.
I
But
know.
I've never heard anyone say it
But
like
it's
that
true.
before.
A lot of people they come into my office and they're like, I just want lipo. And I'm like, look at your belly button. Belly button's sad. You need a tummy tuck, okay?
Okay.
So so that's the number one test, all right? And so this will save you a consultation, all right? And don't come and say you just need lipo when you have a sad face belly button, all right? So number one, that's the thing. Because what it does is we take that skin down. Because why you have a sad face is the skin's overhanging the belly button, okay? So you got to take the belly button out, bring that skin down, cut off the excess, close the muscles up. That's it in a nutshell. Inject a lot of pain medication, which I do. I inject a long-acting 3-day pain medication called Exparil. Look it up. It's good. Make sure your doctor offers it. Next thing, I combine lipo with that most of the time.
Okay.
And then most common thing is breast. So it can just be breast augmentation. So I always like to say, the factory's open for business, and you've got these breasts that just came out of nowhere, and you're like, oh my God, this is great, and it's God's gift, or whatever you want to look at it, you know? And then when you're done having kids, the factory closes its doors, and all the factory workers go away, and then they shrink back down, and it's just like, it's closed for business. And it's kind of depressing because that skin stretches out, and then as you stop, the skin doesn't go back. And so that's why you get this deflated look for breasts. And that's why sometimes just a simple breast augmentation does the trick. It just refills that upper pole, and it doesn't even make you bigger. It just kind of rejuvenates the breast. Now, a lot of times you get a much bigger weight change in that situation, and you might need a lift. The test for that, do you want to know the test for that?
Let's hear it.
All right, you take a Q-tip, you put it underneath your breast, and then you let the breast hang down. First of all, if the Q-tip doesn't stay, you don't need a breast lift, okay? If it just falls to the floor, you're good. Maybe just an augmentation. But if you put the Q-tip there, it stays, and then the nipple is actually below that Q-tip, you might need a breast lift. So that's your test.
You've given us a lot of visuals.
Yes.
The factory, the Q-tip.
Yes. All right. And then the last one, when we do a part of our Grand Slam, that's the 3 areas. If we're taking fat from your abdomen and your flanks, and your buttock had also had a deflation, we can easily do some fat transfer there, which helps rejuvenate the buttock. So those are the 3 things. Tummy tuck, breast augmentation, breast lift, A or B, and then fat transfer. The buttocks, also known as a Brazilian butt lift.
Okay.
Yeah.
Are those popular here in Hollywood?
They are extremely popular, mainly because of Instagram and selfie generation.
Yes.
We just, people want that exaggerated, snatched waist, and I think most of the time it's a great idea. We don't want to overdo it, obviously, but it's very popular.
Okay.
Yeah.
What can a patient do at home to prepare themselves for the surgery?
So it's a big journey. When people come in and they're about to undergo this procedure, it's a little bit more than just a straightforward like breast augmentation. We're doing combination procedure. I tell people you're up here, and about 2 weeks you're going to be down here in terms of how you're feeling. You're going to be questioning why you did this, but you kind of go through this cycle. And I tell people work out, get healthy, prepare your home environment for that first 2 weeks, because that's where you're going to need a lot of support, and that's where you need a lot of energy. So like you can't use your core muscles right after tummy tuck, so you want your arms to be nice and strong. So do a few arm workouts, do some other stuff, get your cardiac output up high, because you can't really work out right after the surgery either, right? So you're going to lose a lot of your fitness, and then you're going to need that strength to help you recover. So it's both mind preparation, body preparation, and support network preparation. You can't do this on your own. Breast augmentation you can do on your own. Tiny little surgeries you can do on your own. But a mommy makeover, you need your whole support network. I often have my patients go to aftercare the first 2 nights just to be kind of away from the kids, because the first thing a kid or dog or pet is going to do when you come home is jump on you. They're like, where have you been? You know? And they sense that you had something done, and they just want to attack you. So.
What can the patient expect to experience during recovery? I know you said in 2 weeks they're not going to be feeling that great. So kind of walk us through the the journey?
Yeah, so
Post-op.
I see my patients a lot post-operatively. Everything is going well. They have questions about, is this normal? Am I supposed to be swelling like this? Is this supposed to be, bruised? I'm like, yep, that's all normal. We do red light on the first 2 post-operative visits for mommy makeovers. That helps bring their swelling down. We do compression starting at 2 weeks. So it's really not until that 2-week mark where we get drains and we get all the stitches out and everything and just cleaned up that you start to turn the corner. That's what I say. I say you're turning the corner around 2 weeks. So give yourself that 2 weeks to kind of just to be there, get through it, binge watch Netflix, whatever you got to do. Eat lots of food. That's actually really important. 20% more calories to heal from a big operation. Yeah, so a lot of people, they're like, I don't want to ruin my results, so I'm starving myself. I was like, guess what? You're not going to heal. Your body needs that protein, so eat up. Go for it.
So after the 2 weeks, what can the patient expect to experience as time goes on?
Awesomeness. Yeah. So
no more sad belly button.
No more sad belly button. Yeah. And it's so funny because it's like, it's that 6-week mark where they start to come in and they're like, oh my God, I'm fitting into stuff better. And it's just like, they give me hugs, they show me pictures, and it's right around that 6-week mark where things really start to look good. And it's funny, when I get to 3 months, it's even better. In 6 months, it's just like, wow, almost all the swelling's gone, right? They're still functional well by then. But then at 6 months to beyond that, they forget where they started. And so one thing I do for all my patients is I print out their before and afters and I send it to them. Yeah. And I'm like, this is where you started. And they're just like, just like, oh my God.
Right, because they're used to seeing their new body now.
Exactly. Yeah, they're used to seeing it. So we don't realize that we look in the mirror every single day. And it's why if you look back, like Google Photos does this thing like 5 years ago, this is you. And I looked at it 5 years ago and I was in Thailand and Cambodia. I was like heavy. And I was just like, wow, that was me, And because I started working out and stuff like that, doing my triathlons. The same thing happens to people, my patients. And so that's why I always give them their before and afters. Like, this is where you started. This is where you are now. High five.
Good job.
Yeah.
One last question for you. Is it typical to have to repeat any of the procedures in a mommy makeover?
No, it's not typical to have to repeat procedures in a mommy makeover because most of the work that we do is long lasting. I think the rare exception to that is if you were to get a tummy tuck and you get pregnant again, you are going to get some stretching.
Right. You
could totally do that. You could get pregnant. Don't worry. We just might need to come see me and we might need to do a little nip tuck on some things. But if you don't gain a bunch of weight or if you don't have children again, those kind of changes don't happen again on their own. So no.
Good to know.
Yeah.
A one and done.
Yep.
All right. Well, Dr. Barrett, thank you so much for all the insight on mommy makeovers. I know a lot of mommies out there are really happy with all the information that you provided.
My pleasure, Amy. Thanks for having me on.
Absolutely. Before I let you go, I'm going to ask you a couple quick questions in our lightning round. Very quick.
Role model. I still haven't figured that one out yet.
That's all right. We got time.
Okay.
All right. Are you a homebody or on the go?
I am a homebody. I love the comforts of my home, home cooked food. I'm super, as any Los Angeles person, I'm super into organic food. I have a garden. I have a beehive in my backyard.
Whoa.
Where I get my own
You
honey.
are dedicated.
Yeah, it's just so I get special food from different farms that, and so I would say I'm more of a homebody just because I enjoy the comforts of my home.
Do you have a beekeeper's costume?
It's not a costume. It's an actual outfit.
But do you wear it?
I do, of course. You're gonna get stung.
Okay.
You gotta
I wasn't sure if you were doing your own thing.
I do it, and it's actually fun. They take care of it. It's the easiest pet to have.
Okay.
They take care of themselves.
Oh, okay, great. That wasn't on my questions. But all right, moving on. Beach or mountains?
Oh, mountains.
Milk, chocolate, or dark?
For milk, chocolate.
Milk, chocolate, or dark chocolate?
Oh, dark chocolate. Yeah. Today I just had 100% cacao, and it tastes like dirt, but it's great.
It was great.
It was great because it's none of the sugar, and you don't get a sugar spike, and it gives you the best energy. I think I had it before the show, actually.
Oh, I can't tell. All right. A book or a movie?
Movie.
Dine in or take out?
Take out.
Art gallery or sporting event?
Art gallery.
Flip-flops or tennis shoes?
Flip-flops.
Sleeping in or getting up?
Getting up.
All right. Well, thank you so much, Dr. Barrett. We appreciate it.
Thanks, Amy. Thanks for having me on.
Absolutely. We learned a lot about mommy makeovers from one of the country's top board-certified plastic surgeons. If you're considering body contouring, we hope we've provided the information you need to decide if you want to take the next step and schedule a consultation. All the healthcare experts featured recommend and accept the CareCredit credit card. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Frina with CareCredit, and I will see you soon.